Good morning, my lovely people. It's my hope you are having a fantastic morning. Mine too, it's fabulous. Let me start by welcoming you back to my YouTube channel, as always, whereby I always give you educational bangers. And I want to start by thanking those who are giving us their topics of interest so that we may discuss them. Be appreciated, or feel appreciated because you are making this channel or you are pushing this channel forward. If you have given your topic and it has not yet been discussed, just be patient with me, and in due time it's going to be discussed. I can't also forget to thank all my subscribers, or whoever is doing anything, however little it is, to push this channel ahead. Feel appreciated. For the better part of last week, we have been discussing about pulmonary nodules, and today we'll be winding up this topic by looking at treatment, or how can you treat pulmonary nodules. Treating pulmonary nodules. Small non-cancerous nodules usually don't need treatment. Remember, the key word here is non-cancerous. Small non-cancerous nodules usually don't need treatment, but a doctor may still want to monitor them over time. Small non-cancerous nodules usually don't need treatment, but a doctor may still want to monitor them over time. If nodules grow large enough to cause a problem or are cancerous, you may need to have them surgically removed. If nodules grow large enough to cause problems or are cancerous, you may need to have them surgically removed. This means an invasive procedure will apply. Surgical options for removal of these lung nodules include the following. Number one, surgical options for the removal of nodules include: number one, opening thoracotomy. Open thoracotomy. During an open thoracotomy, a surgeon makes a large incision between your ribs to access your lungs. As the word states, open, it means something will open up, or there is a very big space or a very big opening to access the lungs. So during an open thoracotomy, surgeons make a large incision between your ribs to access the lungs. So when they access the lungs, they will be able to see where the nodule is and maybe do away with it or remove it through incision. Number two, video assisted thoracic surgery. Video assisted thoracic surgery. Here, a surgeon uses a thin tube called thoracoscope with a camera to see inside your chest and make an incision. Video assisted thoracic surgery. Here, a surgeon uses a thin tube called thoracoscope with a camera to see inside your chest and make an incision. It's considered minimally invasive procedure. Video assisted thoracic surgery. A surgeon uses a thin tube called thoracoscope with a camera to see inside your chest and make an incision. it's considered a minimally invasive procedure. Let's look at the third one, whereby we have robotic assisted thoracoscopic surgery. Robotic assisted thoracoscopic surgery. Robotic assisted thoracoscopic surgery. During this procedure, a surgeon guides a small robotic arm through a tiny incision in your ribs to remove the nodule. During a robotic assisted thoracic surgery, a surgeon guides a small robotic arm through a tiny incision in your ribs to remove the nodule. It's also considered a minimally invasive procedure. It's also considered a minimally invasive procedure. Let's look at the fourth one, whereby we have stereotactic body radiotherapy. Stereotactic body radiotherapy. In stereostatic body radiotherapy, here radiotherapy uses a concentrated beam of radiation to destroy cells. So this means there is no removal but the destruction of the cells. Stereostatic body radiotherapy. Stereostatic body radiotherapy uses a concentrated beam of radiation to destroy the cells. Stereostatic body radiotherapy uses a concentrated beam of radiation to destroy the cells. It may be recommended if you have stage 1 non-small cell lung cancer. It may be considered if you have stage 1 non-small cell lung cancer. Let's look at the fifth one, whereby we have radiofrequency ablation. Radiofrequency ablation. It uses radio waves to create heat to destroy the nodule. This one uses radio waves to create heat to destroy the nodule. So this is aimed at creating heat that destroys the nodule. So there is still no removal. A point to note, very important one, lung nodules are small growths that form in your lung. Lung nodules are small growths that grow from your lung. They are common and usually not cancerous, so they are benign. Lung nodules are small growths that form in your lung, and they are common and usually not cancerous. Lung nodules are discovered when you receive imaging for an unrelated condition. Lung nodules are small growths that form in your lungs. They are common and usually not cancerous. Lung nodules are discovered when you receive imaging for unrelated condition. This means it's a condition which is not related to the lung disease or to the lung. If a doctor discovers that you have a nodule, if a doctor discovers that you have a nodule, they may recommend follow-up scans to see through if changes. This simply means they may order for more investigations in order to come up with a conclusion on what you have. So, if a doctor discovers that you have a nodule, they may recommend a follow-up scans to see through if it changes over time. They may recommend follow-up scans to see how it changes over time. If cancerous, it can be surgery removed. If the nodule is cancerous, it can be surgery removed. This marks the end of our video today. Thank you for following me. Thank you for your time, and let's have a lovely day ahead.